Let's continue our discussion on face reading. Hyperthyroidism. Hyperthyroidism is an endocrine disease caused by excessive secretion of the thyroid hormones as a result of a number of conditions. Pathologically, it is a diffuse disease. Common symptoms of hyperthyroidism include increased appetite and defecation, an enlarged thyroid gland, anxiety and irritability, a bitter taste in mouth, a dry throat, mildly prominent eyes, sluggish eyelids, weight loss, and sweaty palms. The onset of hyperthyroidism often has certain triggers, of which the most common are infection, pneumonia, tonsillitis, pregnancy, and emotional trauma. Facial reading. The facial manifestations of hyperthyroidism, as seen in the picture below, are a thick neck accompanied by a vascular murmur. Most patients also have symptoms such as bulging eyes, swollen eyelids, and vision loss. Therapeutic methods. Diet plays an especially important role in the treatment of hyperthyroidism. At the same time, increase your physical exercise and balance your mood. Patients with hyperthyroidism should rest and avoid excessive fatigue. The dietary advice would be to eat less pungent foods and more fresh fruits and vegetables. Maintain a high protein diet. Exercise would be for patients with hyperthyroidism should avoid strenuous exercises. The best exercise would be yoga, which not only enhances physical fitness but also regulates the emotions and emotional adjustments. Patients with hyperthyroidism are prone to irritability, and long term irritability can worsen the condition. It is important to regulate your emotions, and a good mood and balanced mental state will benefit recovery. As seen in the illustration above, we must massage the Taichung point, which can clear away liver fire, dredge the liver, and regulate qi. It can also relieve hyperthyroidism caused by stagnation of liver qi. Massaging the Yongquan point can dispel heat and open the orifices, nourish yin and reduce fire, and alleviate symptoms such as irritability, aversion to heat, and excessive perspiration caused by hyperthyroidism. Press knead the Taichung and Yongquan points with your thumb for 1 to 3 minutes once daily. Thank you for your attention.
Now we go to interviewing, this time on menstrual clots. The normal flow does not coagulate and there are no clots. The blood is neither dilute nor thick. The following are the main areas of questioning with regard to the consistency of menstrual blood. Clotted with dark full clots means stasis of blood or cold in the uterus. Clotted with dark but fresh-looking clots signifies heat. Large clots would mean stasis of blood. Small dark clots but blood not dark, that's cold in the uterus. Watery, blood or yin deficiency. Sticky, dampness or damp heat in the uterus. We consider dark menstrual blood with large dark clots as a sign of blood stasis in the uterus, even in the absence of any other symptom or sign. Now let's go to the differentiation of patterns for menstrual clots. First is blood stasis in the uterus and liver. Menstrual blood is dark with the dark large clots associated with painful periods relieved by the passage of clots, periods starting with a brownish discharge, periods stopping and starting, painful periods, irregular periods, infertility, purple tongue, wiry pulse. Acupuncture points to open the chongmai. We have spleen 4 with P6, liver 3, kidney 14, and spleen 10. Another pattern for menstrual clots would be cold in the uterus. Small stringy clots with bright red blood, painful periods alleviated by application of heat, feeling cold during the periods, dilute menstrual blood, pale tongue, deep tight pulse. Acupuncture points. We open the chongmai by needling spleen 4 with P6, liver 3, kidney 14, spleen 10, ren 4, ren 3, ren 6. Blood heat as a pattern for menstrual clots. The Clots would look dark but fresh looking, heavy periods, feeling of heat, red face, red tongue, overflowing rapid pulse. And finally, Qi deficiency as a pattern for menstrual clots. The clots would be small, pale red, fresh looking, heavy period with bright red and dilute blood, pale face, tiredness, dizziness, pale tongue, and weak pulse. Thank you very much for your attention.
Let's now discuss hand-tie yin lung meridian with acupuncture point feng shui, the greatest hole. Lung 6 or feng shui is located on the anterolateral aspect of the forearm on the line connecting lung 5 with lung 9, 7 tunes superior to the palmar wrist crease. Lung 6 or feng shui is the cleft or accumulation point of the lung meridian. When the lung feels it is losing connection with heavenly qi, either because the lung is failing to descend the qi or because the clear qi of the lung is failing to rise and diffuse, it can feel as though the person will fall through the depths of grief forever with nothing to hold on to. Greatest hole can enrich the lung with abundant qi and blood to strengthen it and reestablish connection. Blood and qi gather at qi cleft accumulation points, making them good points to use when nourishing and strengthening our key issues. The revitalization afforded by these points, which are not command points, even though they are located in the command point territory, has given them the reputation of being like a periscope. They have fostered a new outlook and appraisal of circumstances. All qi cleft points are useful for invigorating or dispersing pain or obstruction along the particular channel on which they are found and are much used in acute conditions. Lung 6 strengthens the lung meridian, regulates lung qi, clears heat, stops bleeding, and is used for severe acute conditions, stagnation, and channel problems. Its indications are sustain and supports the body, mind, and spirit. It is for stagnation of lung qi, example in asthma and bronchitis. It is for acute heat in the lungs or phlegm heat in the lungs, and for channel pain. For acute feelings of sorrow, loss, or emptiness in a patient's life, or when grief seems to predominate. It is for profound feeling of grief or pain upon losing someone or something. Consider for acute chest problems or infection like bronchitis, asthma, or persistent cough. Also for articular troubles of the shoulder or elbow. Thank you for your attention.
Let's discuss differential diagnosis, Western and Chinese medicine, the musculoskeletal pain. Number one, stemming from overuse, there is joint pain, muscle pain, swelling, joint stiffness, bruising. Number two, stemming from osteoarthritis, there is gradual onset of deep aching joint pain, worst after exercise, better for rest, joint swelling, limited mobility, morning stiffness, grating of joint with motion, damp weather aggravates. Number three, stemming from rheumatoid arthritis, women affected 3 times more than men. Peak incidence between 25 and 55 years. Chronic inflammation of joints leading often to deformity, swelling, redness, pain, marked stiffness after inactivity. Non-joint manifestation of RA may affect lungs, heart, blood, eyes, skin, other organs. Number four, stemming from tendonitis, that is pain, tenderness along a tendon, worst with movement or activity, worst at night. Number five, stemming from bursitis, joint pain and tenderness, swelling, warm over affected joint. Number six, stemming from a fracture, musculoskeletal pain with misshapen limb or joint, swelling, bruising, or bleeding numbness, tingling, protruding bone, acute pain, limited mobility. Number 7, stemming from gout, typically present with the sudden onset of severe pain in a joint, commonly big toe, which is hot and red and intolerant to least touch or movement. Number 8, stemming from osteomyelitis, rapid onset of pain in bone with marked tenderness, redness, swelling, warmth. Fever, marked malaise, danger of blood poisoning. Diagnostic questioning according to number 1, nature of pain, acute, invading pathogens, blood stasis. Chronic kidney deficiency, spleen chi deficiency with dump obstruction, sharp stabbing fixed, that is blood stasis, vague movable variable, stagnation of liver chi, wind patterns. Number 4, aggravation, cold or damp weather, that is cold damp. Stress, stagnation of liver chi, activity, deficiency pattern, blood stasis. After sex, kidney deficiency. In the morning, spleen chi deficiency with damp obstruction. Exposure to wind, that is wind. Number 3, amelioration. With rest, kidney deficiency. With exercise, stagnation of liver chi, spleen chi deficiency with damp obstruction. With heat, cold or cold damp, kidney yang deficiency. Number 4, differentiation of B. When B, pain moves from joint to joint, damp B, fixed pain, soreness, swelling, heaviness, numbness. For the cold B, there is severe pain in one joint. Heat B, severe pain, heat, redness, inflammation. Bone B with swelling, bone deformities. Letter A, for the wind, we use bladder 12, GB31, GB39, do 14, Sanjiao 6, bladder 17. For the cold, stomach 36, Ren 6, SI5, bladder 10, do 14. For the damp, we use spleen 9, spleen 6, GB34, stomach 36, bladder 20. For the heat, we use stomach 43, liver 4, LI 11, do 14. For the bone, bladder 11, GB39. Sangpo patterns in chronic conditions, there is chi and blood deficiency, phlegm in joints, stasis of blood. Thank you for your attention.
Let us now discuss the basic concept, formation, and physiological actions of body fluids. Body fluids is a general term for all the normal fluids in the body. It includes the various kinds of fluids existing in all the organs and tissues, as well as the normal liquid secretions, including gastric juice, intestinal juice, nasal discharge, saliva, and tears. Like chi and blood, body fluids are one of the basic substances constituting the human body. CM distinguishes two general varieties of body fluids, jin and ye. These differ in their characteristics, actions, and distribution. In general, the jin type of fluids is clearer and thinner, moves more freely, and is principally distributed through the superficies, including the skin, the muscles, and the orifices. It also enters the blood vessels readily and has the actions of nourishing and moistening. The ye type of fluids is more viscous and does not move as freely. It permeates the bones and joints, the visceral organs, the brain, and the marrow, where it acts to moisten these structures. Each of these two types of fluids readily transforms into the other. Hence, they are generally referred to together as jinye, that is, body fluids. In clinical context concerning body fluids, it is usually clear which type of fluid, jin or ye or both, is under consideration. Body fluids derive from drink and food, through digestion by the stomach, separation of the clear from the turbid by the small intestine, and transformation by the spleen. Thus, the abundance and adequacy of body fluids is closely tied to the physiological actions of these viscera. The distribution of body fluids is accomplished mainly through the joint action of the spleen, the lung, the kidney, and the sanjiao. Following transformation by the spleen, fluid is first conveyed upward to the lung, which then distributes it. Part of the fluid is delivered to the body surface to moisten it, and following its further metabolism, the pores secrete the surplus as sweat. Another part is delivered downward following depuration by the lung to all the organs and tissues to nourish and moisten them. A portion is conveyed by the sanjiao to the bladder, where by the transforming action of the kidney, its essential part is further distributed to the entire body, and the residual part becomes urine to be discharged. Other viscera also affect the distribution of body fluids. The liver's conducting and facilitating action enhances the distribution of body fluids. The sanjiao acts to keep its flow unimpeded. The large intestine partially absorbs the water from the wastes of food and drink for reutilization. In summary, the metabolism of body fluids depends upon the functional coordination and balance of many viscera. Of them, the lung, the spleen, and the kidney play the main roles, and the action of kidney yang provides the motive power for the whole metabolic process. Dysfunction of any of these three organs can lead to disturbance in the metabolism of body fluids and can result in illnesses of stagnation and retention of water. Now let us look at the physiological actions of body fluids, moistening and nourishing action. The fluid distributed to the body surface moistens and nourishes the skin and hair, the muscles, the eyes, the nose, the mouth, and others. The fluid transported to the internal organs, the bones and marrow, the spinal cord, and the brain nourishes and moistens these parts, enabling them to express their many physiological functions fully. Next is component of blood. Within the structure of the human body, the fluids continually enter the blood vessels by means of minute collateral vessels. Thus, body fluids are a basic component of blood. At the same time, through the confluence of fluids, both from outside and from within the vessels, they adjust the thickness and the volume of the blood. Thank you so much for your attention. Let us now go to diagnosis according to Zhangfu organ patterns. The topic is kidney yin deficiency and lung yin deficiency. The lung is a delicate organ. It is the only yin organ that is in direct contact with the environment outside of the body, which makes the lung vulnerable to invasions of exogenous pathogenic qi. The consequence of this is that dryness and heat can damage lung yin. The lung and the kidneys cooperate closely with regards to the physiology of fluids in the body. One of the functions of the kidneys is to moisten the lung. This means that kidney yin deficiency can injure lung yin, and a chronic lung yin deficiency will place a strain on kidney yin. Kidney and lung yin deficiency can be a consequence of respiratory disease, poor indoor climate with dry air, tobacco smoke, air pollution, aging, mental and physical overexertion, chronic illness, stress, worry, unresolved or prolonged sorrow, too little sleep, too much sex, too much coffee, dietary factors and medicines that are hot or spreading in their energy, chronic blood deficiency or heat conditions, and chronic yin deficiency conditions in other organs. The symptoms and signs are dry or tickling cough that is worse in the evening and at night, or when the person is tired, the cough is weak. There's dry throat, ticklish sensation in the throat, shortness of breath on exertion, dry skin, lumbar soreness, sore knees, insomnia, night sweats, tinnitus, dizziness, dark and scanty urine, poor hearing, thin body, a thin tongue with a lack of coating, and there may be 2 small diagonal cracks in the front portion of the tongue. The pulse will be fine or empty, or the pulse may be relatively weak in the right chun and left chi positions. The key symptoms are dry cough, dry throat, and lack of tongue coating. The treatment principle is to nourish kidney and lung yin. The acupuncture points to choose from are kidney 3, kidney 6, kidney 7, kidney 9, Ren 4, Ren 17, lung 1, lung 9, UB13, UB23, and UB52. The needling technique to be used is tonifying. The explanation for the points is that kidney 3, kidney 6, kidney 7, kidney 9, Ren 4, UB23, and UB52 nourish kidney yin, whereas lung 1, lung 9, and UB13 nourish lung yin and regulate lung qi. Kidney yin deficiency and lung yin deficiency can be caused by kidney yin deficiency, lung yin deficiency, lung dryness, lung heat, phlegm heat in the lung, and can result into phlegm and liver yin deficiency. Thank you so much for your attention.
Let us now discuss the disturbance of blood. This condition has 2 main categories: insufficiency of blood and disturbance of blood circulation. The latter comprises blood stasis due to retarded blood flow or overheating of blood, leading to accelerated blood flow and hemorrhage. Blood insufficiency. In this condition, the volume of blood is insufficient. If blood is unable to provide adequate nourishment to the body, the pathological effects are similar to those of insufficient blood volume. Reduction of blood volume may be caused by massive loss of blood without sufficient replenishment, or when deficiency of the spleen and stomach leads to malnutrition, so that these organs are unable to transform food essence into blood adequately. Blood insufficiency can also occur in cases of chronic consumption due to prolonged illness. Reduced nourishment of organs and meridians by blood can cause reduction in their functions. Clinically, this is manifested by symptoms of deficiency, either regionally or systematically. Thus, there may be a pallor and loss of luster of the complexion, the lips, the tongue, and the nails. There may be dizziness or vertigo, sustained palpitations of the heart, and shortness of breath and weakness. There may be numbness of the hands and feet and stiff joints. There may be dryness and irritation of the eye and blurred vision. Blood stasis. This is a pathological condition of retarded or impeded blood circulation or even gelling of blood. There are 5 main circumstances that produce blood stasis. Qi stagnation can cause obstruction of blood circulation. Qi deficiency can retard blood circulation. Accumulation of turbid phlegm in the meridians can block the blood vessels. Invasion of blood by the cold disease evil can induce gelling of blood. Invasion of blood by the heat disease evil can, in certain circumstances, also induce stasis of blood. Once brought about, blood stasis can further impede the movement of qi, so that qi impedance and blood stasis enter into a vicious cycle of mutual aggravation. Since impeded circulation is the main pathological mechanism underlying blood stasis, when static blood affects specific organs or regions of meridians, it can cause blockage of meridians with pain and swelling. At the same time, there may be darkening of the complexion, a dry and scaly skin, cyanotic lips and tongue, ecchymosis, and telangiectasis. Overheating of blood. In general, overheating of blood is a condition of heat in the blood level of warm diseases and can propel blood to circulate more rapidly than normal or cause blood to flow abnormally. This condition can come about in several ways, including exogenous heat evil entering into blood and exogenous cold evil invading the interior and transforming into heat. The commonly seen progression of heat illnesses into the nutritive level or blood level of warm illnesses belongs to this type of pathological change. Additional causes include mental depression, as well as the passions transforming into fire and blazing endogenous fire accumulating in the blood level. Since warmth propels blood circulation, overheating of blood accelerates circulation. When there is heat in the blood level, then the yin fluids are easily damaged. In severe cases, there may be bleeding. Hence, the pathological manifestation of blood overheating of blood characteristically includes excessive consumption of blood, damage to yin, and hemorrhage, in addition to fever. Hemorrhage. Hemorrhage occurs mainly when the vessels are damaged or when qi is deficient and unable to control blood flow. It can come about in several ways. Mainly, it occurs as a result of the abnormal flow of qi, scorching of the vessels by fire, a traumatic injury to the vessels. Because the blood vessels reach every part of the body, bleeding can occur at any place. The symptoms vary with the location of the hemorrhage. For example, injury to the lung can cause hemoptysis. Injury to the stomach vessels can cause hematemesis or melena. Injury to the large intestine vessels can cause hematochezia. Injury to the bladder or urethra vessels can cause hematuria. Injury to the vessels associated with the Chong and Ren meridians can cause metrorrhagia. Injury to the nose can cause epistasis. Hemorrhage can also occur when prolonged illness impairs spleen Qi. This leads to failure of the spleen to control blood, which in turn allows blood to extravasate, as in subcutaneous hematoma, for example. Thank you for listening.
Let's continue our discussion on epigastric pain with quantity and nature of food. Let's talk about first quantity of food. Problems with the quantity of food may lie in eating either too little or too much. In affluent industrialized countries, it would seem strange that anyone could suffer from insufficient food intake. But even here, there are pockets of extreme poverty, and certain groups in the population may suffer nutritional deficiencies simply from not having enough food. Secondly, nutritional deficiencies can arise when people subject themselves to very strict slimming diets. In some cases, this leads to severe anorexia. Thirdly, people may have a deficient diet not because they do not eat enough, but because they eat devitalized food that are devoid of any nutritional value. Fourthly, although when properly applied, vegetarian or vegan diets can be perfectly healthy and also ecologically and ethically sound, people who follow them may unwittingly deprive themselves of essential nutrients seen from the point of view of Chinese dietary principles. For example, some vegetarians may tend to eat too much cheese, which produces dampness, or salads, which produce cold and injures spleen yang. On the other hand, they will not eat warm blood-producing foods such as meat, and there are few vegetarian foods which as such a quality. A person who suffers from severe deficiency of blood, for example, would benefit from a small amount of meat in the diet. Finally, old people who live alone often tend not to eat enough because they lack the stimulation of eating in company and cannot be bothered to cook for one person only. Eating too little in various ways described previously causes a dull epigastric pain, tiredness, and weak muscles. Eating too much is, of course, a very frequent cause of stomach disorders. By this, we mean eating too large meals rather than constant nibbling, which will be discussed later. Eating too much very simply leads to retention of food so that stomach qi cannot descend. This causes sour regurgitation, epigastric pain, fullness, belching, and foul breath. Of course, there is no single fixed standard that lays down the ideal quantity of food eaten. Much depends on a person's occupation, and someone who is engaged in heavy physical work should obviously eat more than someone whose work is sedentary. As the amount of food eaten should be regulated according to one's physical activity, it follows that at weekend, when most people are inactive, one should eat less than during the week in most countries. The exact opposite happens when people tend to have large meals that weekend. Now let's talk about the nature of food. The nature of food eaten is of paramount importance in stomach disorders. Food are classified according to their nature, that is cold, cool, or neutral. Under taste, that is sour, bitter, sweet, pungent, or salty. The subject of foods and their action in health and disease is a vast one and beyond the scope of this book. With regard to stomach disorders, 4 broad categories of food can be identified. First, we have cold foods. These are raw vegetables, salads, fruit, cooked cold drinks, and ice cream. Excessive consumption of this food will tend to create cold in the spleen and stomach and ensuing epigastric pain. Next type of food, hot spicy foods. This includes curries, spices, lamb, beef, and alcohol. Excessive consumption of this food produces stomach heat, which may manifest with a burning epigastric pain, thirst, and a yellow tongue coating. Next type is sugar and sweets. An excessive consumption of this may tend to produce both dampness and heat in the stomach. The next type, greasy foods, fried foods, and dairy foods. An excessive consumption of this leads to the formation of phlegm or dampness in the stomach. Chinese dietary principles are very old and do not consider the great changes that have occurred in the growing and production of food in the past decades. Modern food is subject to considerable chemical manipulations, and a great many of the food additives can obviously be a cause of stomach problems and indeed of many other disorders. For example, the correlation between artificial colorings and hyperactivity in children is well documented. Modern food contains not only additives such as flavorings, colorings, preservatives, and emulsifiers, but also traces of drugs such as antibiotics and hormones found in milk and meat. Moreover, food and water are often contaminated with the residues of chemical pesticides and fertilizers. All this can obviously be causes of stomach disorders. Thank you for listening.